clicking that some people experience whenever they come to see a physical therapist or a dentist with TMJ. If your clicking is painful, there's a couple different things that could be happening. One is your disc could be displacing from its position it's supposed to stay in as the mandible rolls forward whenever you open. So when you open, if people put their hand there or they can hear the click. The other thing that could happen is whenever you close, it clicks back. So that's a disc displacement with reduction. If it only clicks once upon opening and doesn't go back, it's then something else. It's called disc displacement without reduction. This is usually the more chronic version. You do want it to reduce. If it's not reducing, that can be very painful because then your retrodiscal tissue is getting pinched. What we remind people too is over time that retrodiscal tissue can kind of morph itself into fibrocartilage, and that fibrocartilage over time will be less sensitive and less painful of a material in that area. The other thing that could be going on whenever you get a click with opening is hypermobility in that joint. So let's say you go to open your mouth and you're only getting clicking on one side of the jaw. That clicking can be from actually the condyle going over what's called the articular eminence, which is a speed bump, think of it, in the top of the skull that it rides over. It's not supposed to go completely over this articular eminence, but in certain people who have hypermobility throughout their body, they're a little bit more prone to this articular eminence click. In this case, whenever you have an articular eminence click, you want to teach the patient to avoid maximal opening to protect the joint a little bit more. For patients who I suspect they have the articular eminence click, it'll only occur with opening, and instead of the disc click, the articular eminence click with hypermobility is it right at the end range. So that's how you differentiate one versus the other. Another thing I will do with patients is run them through the Baton Hypermobility Index. So I'll see if they can stand up, touch their palms flat to the floor. I won't go over that right now. So that's one point. Another one is, can they extend both their pinkies past 90 degrees here? Can they touch their thumb to their forearm, both sides? Can they hyperextend their elbows, and can they hyperextend their knees? So there's 9 different markers for hypermobility to assess if your patient may be experiencing that.